If you're living with pain, whether it's a persistent ache in your lower back, a sharp twinge in your knee, or stiffness in your shoulders, it is time to stop a cycle that has failed you. The conventional approach of chasing symptoms with passive therapies and temporary fixes is a broken model. Stretching a tight muscle, rolling on a foam roller, or even undergoing surgery often addresses the effect, not the cause. These are reactive measures in a world that demands a proactive solution. The truth, backed by a growing body of biomechanical science, is that the human body is not designed for passive repair. It is designed for active, intelligent movement. Pain is frequently not a signal of damage, but a loud alarm bell signaling that you have lost fundamental primal movement patterns. Your body is speaking a language of deficiency, and the translation is simple. You have forgotten how to move. At Rapid Relief Health, we do not offer quick fixes. We offer a restoration. In this guide, we will dismantle the myths that have held you back and provide you with the 5 non-negotiable, fundamental movements that form the bedrock of a resilient, pain-free body. This is not a workout. It is a rewiring. It is a return to the movement literacy your body expects and requires. Movement number 1, the Primal Resting Squat, reclaiming your anatomical birthright. The deep squat is not an exercise. It is a biological imperative. Observe any toddler and you will see perfect, effortless form. A deep, relaxed, resting position that we as adults systematically unlearn. By our mid-20s, this fundamental posture is often lost to chairs and sedentary living, and with its departure comes a cascade of compensatory issues. The deep squat is a holistic reset for your lower body. It acts as a gravitational traction device, gently decompressing the lumbar spine and creating space between the vertebrae. It unlocks the hip joints, moving them through their full intended range of motion, which in turn releases tension in the glutes and lower back. It retrains the knee joint to track properly under load, and it naturally reactivates and strengthens the often neglected pelvic floor. If you experience tight hips, nagging low back pain, or noisy cracking knees, the loss of this position is almost certainly a primary contributor. The secret to reclaiming it is consistent exposure, not perfection. Your goal is not to achieve a picture-perfect gym squat overnight. Your goal is to reintegrate this shape into your daily life. Let gravity be your teacher, patiently reminding your tissues and joints of their intended function. How to begin your re-education. Start where you are. Do not force a depth that causes pain. The most powerful regression is to elevate your heels. Place a small weight plate, a book, or a wedge under your heels. This immediately reduces the demand on your ankle mobility and allows you to sink deeper with a straight back. Use support. Hold on to a sturdy chair, a countertop, or a door frame to support your weight. This allows you to focus on the positioning of your hips and spine without the fear of falling backward. Accumulate, don't marathon. This is not about a single grueling hold. The goal is to accumulate time throughout your day. Sit in this position for 1 minute while you scroll on your phone. Hold it for 2 minutes while watching television. Aim for a cumulative total of 5 minutes a day, gradually building to a point where spending 30 minutes total in a deep squat throughout the day feels natural and restorative. The mindset shift. Reframe this from a stretch or exercise to a resting position. This is how your ancestors ate, socialized, and rested. It is supposed to feel grounding and comfortable. By making it a daily habit, you are not just improving flexibility, you are restoring a fundamental human posture.
Movement number 2, the passive hang, spinal decompression and shoulder recalibration. Modern life is a story of chronic compression. We sit, we slouch, we hunch forward. Our spines are constantly under a downward load, and our shoulders are perpetually pulled into internal rotation. The passive hang is the antidote, a powerful act of axial decompression that resets your entire upper body mechanics. Hanging is the shoulder rehabilitation you never received. It creates space in the shoulder joint, allowing the scapula to slide freely into a natural, stable position. It gently tractions the entire spinal column, counteracting the compressive forces of gravity and sitting. Furthermore, It is one of the most potent exercises for building foundational grip strength, which is a remarkably strong predictor of overall health and longevity. How to integrate the hang. Begin with a dead hang. Find a secure pull-up bar, grip it with your hands shoulder-width apart, and allow your body to go completely limp. Do not actively pull yourself up, simply surrender to the stretch. The goal is to relax your shoulders, not engage them. Soften your breath. It is natural to hold your breath and tense up. Consciously focus on taking slow, deep breaths. With each exhale, visualize the tension melting away from your neck and shoulders, allowing your body to sink deeper into the hang. Manage the intensity. If your grip fails quickly, you are not alone. Use gymnastic chalk to improve friction. Alternatively, keep your feet lightly on the floor or on a box to support a percentage of your body weight. The objective is to accumulate time in the decompressed position, even if it is assisted. Progress with consistency. Aim to accumulate several minutes of hanging time throughout your day. A 30-second hang, repeated multiple times, is far more beneficial than one forced, painful minute. Over 30 days of consistent practice, you will notice a dramatic improvement in shoulder mobility, posture, and a newfound sense of space in your upper back and spine. Movement number 3, the Jefferson Curl. Rebuilding a resilient, fearless spine. You have likely been told a dangerous half-truth. Never round your back. While bracing your spine under heavy load is a specific skill, the inability to safely flex your spine is a major cause of fragility and pain. The Jefferson Curl is a controlled segmental flexion exercise that directly addresses this fear and stiffness. Chronic back pain is often less about an acute injury and more about a lack of motor control and tissue tolerance. Your nervous system, fearing movement, braces and locks down, creating a vicious cycle of stiffness and pain. The Jefferson Curl is a systematic process of earning back the trust and capacity of your spine and posterior chain, hamstrings and glutes. The safe progression to a bulletproof back. Master body weight articulation. Stand with your feet shoulder-width apart. Tuck your chin gently and begin to roll your spine forward, one vertebra at a time, as if placing each one on a shelf. Imagine your spine as a chain being lowered link by link. Go only as far as you can with control. Then reverse the motion with the same deliberate care. Introduce minimal load. Once you can move through the full range of motion with body weight comfortably, hold a lightweight, a 5 kilogram or 10 kilogram dumbbell or kettlebell in both hands. The load is not for building muscle, but for providing a gentle traction force and teaching your tissues to bear load in flexion. Prioritize control over depth. The goal is not to touch your toes with a heavy weight. The goal is to maintain perfect segmental control throughout the entire range of motion. Progress the weight slowly and patiently over weeks and months.
Overcome the mental hurdle. This movement can feel psychologically uncomfortable because it contradicts a deeply ingrained rule. Trust the process. By progressively overloading this movement, you are building a spine that is resilient in all positions, not just a rigid one that is vulnerable to unexpected forces. Movement number 4, the 90-90 hip shift, the key to knee and gait health. The health of your knees is almost entirely dictated by the health of your hips. In our chair-bound society, the hips become chronically compressed and lose their rotational capacity, particularly internal rotation. This lack of mobility forces the knee joint to compensate, leading to pain and deterioration. The 90-90 position is a dynamic drill that trains internal and external hip rotation under controlled pressure. This is not a passive stretch where you hold a position and hope for change. It is an active, neurological exercise that teaches your femur, the thigh bone, how to rotate efficiently within the hip socket. Restoring rotational integrity. Find the position, sit on the floor with one leg in front of you, bent at a 90-degree angle, and the other leg to the side, also bent at a 90-degree angle. Your shins should be parallel to each other. Start with assistance. In the beginning, place your hands on the floor for support. The goal is to gently shift your weight from the front leg to the back leg, keeping both hips firmly on the ground. You will feel a significant stretch in the hip of the leg that is moving into internal rotation. Focus on quality. Move slowly and deliberately. If your knees hurt, reduce the range of motion or place a pillow under them for support. The priority is pain-free, controlled movement. Progress to independence. As your hip mobility improves, you will be able to perform the shifts without using your hands for support, increasing the load and control demanded from your hip stabilizers. This directly translates to more stable knees, a deeper squat, and a healthier, more powerful walking gait. Movement number 5, thoracic bridge and rotation. Unlocking your upper back to free your entire body. The source of your lower back pain is often a stiff, immobile upper back. Your thoracic spine, the mid to upper section of your back, is anatomically designed to flex, extend, and, most importantly, rotate. Modern life, dominated by phones and computers, has locked it into a rigid, flexed position. This thoracic stiffness forces your lumbar spine, lower back, and shoulders to move in ways they were not designed to move, leading to pain and dysfunction. Restoring thoracic mobility is like releasing the parking brake on your posture. It creates space for your rib cage to expand, allowing for deeper breathing. It restores natural shoulder function and can make you feel instantly taller. Reclaiming your thoracic movement. The thoracic bridge.
The weighted pullover. Lying on your back, hold a light weight with both hands and slowly arc it from your hips to over your head and down to the floor. This movement combines thoracic extension with shoulder mobility, powerfully opening the entire anterior chain. The outcome. Consistent practice will lead to improved posture, the disappearance of many types of shoulder impingement, and a significant reduction in compensatory lower back pain. You will breathe easier and move with a newfound sense of freedom. The path forward. Consistency over complexity. You do not need an encyclopedia of 100 different exercises. You need mastery of a few fundamental patterns performed with consistency, intention, and intelligent progression. These 5 movements are not optional extras in your fitness routine. They are the foundation upon which a pain-free, resilient body is built. When you lose these movements, your body begins to break down. When you reclaim them, you give your body the tools it needs to heal and thrive. This is not magic. It is not a passive therapy. It is the proactive, empowering work of restoring your body's native movement language. The journey begins with a single, conscious decision to move differently. Your body is waiting to remember what it feels like to be whole. Start today.